If better health is among your New Year's resolutions, you might want to consider taking a low-dose aspirin every day.
It's known to reduce the risk of a heart attack, but now a new study in the journal The Lancet shows it might also protect against cancer. Dr. Zorba Paster joins us from his clinic in Oregon. Hi, Zorba, good to see you.
Happy New Year.
Hi, great to see you guys.
So tell us about this study.
Well, this study was a study of studies. So a number of statisticians, epidemiologists got together to look at the aspirin data because there have been some controversies concerning it. They looked at cancer, they looked at heart disease, and they looked at overall mortality, how many people actually die. And here's what they've concluded. People on aspirin, low dose or a regular aspirin, it doesn't make a difference which dose of aspirin, have a reduction of about 7 to 9% in the risk of death for heart attacks and cancer. Colon cancer actually leading the pack with a reduction of maybe 25 to 30%. The reduction was very much noticeable after around 5 to 10 years of aspirin use, and even up to 20 years you could see a difference. So an aspirin a day may indeed keep the doctor away.
Well, you're here, so that didn't work because I take an aspirin a day. Is there any side effects to all this?
Well, that is, of course, the issue. The side effect of aspirin is bleeding. So GI bleeding actually is a significant side effect, and people can get it, especially if they're taking aspirin and an anti-inflammatory or aspirin with a blood thinner such as Coumadin or Plavix, and so they've got to talk to their doctor about that. It's got some advantages, but it's got disadvantages there. And that's the major side effect. And the other is some people don't tolerate it, but they take a lower dose aspirin or a coated aspirin, or they take it after meals. It'll often get better. But looking back at this again, aspirin is an incredibly inexpensive product that can reduce heart attack, stroke, cancer, and premature death by 9% in men and 7% in women over a 5 to 10 year period. That is a major reduction. If this drug were a patented drug, it would be a major seller worth billions of dollars.
Yeah, those are significant statistics. So
right. And especially with colon cancer.
When you mention a low-dose aspirin, are you thinking like a baby aspirin?
Well, an 81 milligram aspirin, the low-dose baby aspirin, is fine, but also a regular strength aspirin. And one of the things they found was there was no difference between them. So on the whole, it's better to take the low-dose aspirin, better to take that than the regular aspirin, because a regular aspirin can have more side effects. And it's not as if you get more benefits. So I think a low-dose baby aspirin every day that's coated is what I would recommend more than an apple a day.
But check with your doctor. Check with your doctor first.
Of course, always.